Hi, great day to everyone. It's me again, Francis May. Enrolling to this course is a smart idea if you're planning to establish in the future your own or self-developed nursing school, which could be highly competitive internationally. As we all know that comparative education is evaluating the every inch of educational system. It evaluates the process, the approach, system, even the objectives and outcomes. As according to Gray in 1995, professionals in this area of endeavor are absorbed in advancing evocative terminologies and guidelines for education worldwide, enhancing educational structures and producing a context to which the success and effectivity of education programs and initiatives can be assessed. This is bounded to the purpose of educational changes and improvement. Studying this subject has aided me to achieve the following. First, I have learned the purposes of studying comparative education in nursing and its scope. Internationalization has created a world market that favors mobility, for workers to take advantage of new opportunities and for employers to attract workers. Mechanisms are needed to compare education and qualifications of applicants against global standards. Because nations have specific requirements related to technology and disease prevalence, as well as cultural, social, and environmental differences, it is unlikely that education will ever be uniform. However, it should be possible to determine common competencies and skills upon which assessment could be based, and this is the very purpose of this study. I have understood the current education systems, processes, and outcomes with reference to the past. These early nurse education programs were, in reality, little more than apprenticeship programs that used student nurses for their labor. Despite their significant shortcomings, however, they proved very popular with both hospitals and students and created a pattern of hospital-based nurse education. And while many disparaged the exploitative nature of the nurse education system, the presence of trained nurses with their emphasis on cleanliness, orderliness, and close observation of patients successfully transformed hospitals into scientific institutions of caring. Schools of nursing did improve over time. Better oversight of nursing education programs by state licensing boards, as well as the increasingly complex demands of patient care, led the schools to increase the amount of theoretical instruction and decrease the amount of direct work performed by students. I have understood the role or importance of internationalization in the effort to increase the future human resource capabilities of our country in nursing education. Training our country's own developed and produced excellent nurses is also part of the result of this internationalization in nursing education. Our nurses aren't just trained with the local systems, but as well as internationally. I have understood the relationship between education and society, locally and internationally. I have identified the internationally accepted standards in maintaining nursing schools. I can now compare our country's nursing education with that of international systems. Hence, be able to differentiate and appreciate educational philosophies, theories, and practices specifically on nursing education as observed and/or researched internationally. I have appreciated the value of benchmarking some internationalization recommendations of other countries which would support in the development of a more advanced and futuristic nursing education. I am prepared to assist any institution in the development of curriculum and practices. So that's it. After all, we can now help design our nursing curriculum and educational system to be internationally competitive, thanks to this comparative study of internationalization in nursing education.